According to PBS.org, 44 million people in America do not have health care insurance, and another 38 million people have poor health care insurance. As one of the richest countries in the world, I think it's insane we don't have universal health care. According to nationalpriorities.org, in 2015, the U.S. spent about $598.5 billion on the military, about 54% of the federal discretionary spending. The United States needs Medicare for all because it can save more lives, it can improve public health, and countries with universal health care spend less on health care per person. Before I talk about the advantages of universal health care and why I support it, I want to discuss some disadvantages. In Canada and Australia, countries with universal health care, the healthcare system wait time is long if it isn't seen as an emergency. According to CNBC, 30% of Canadians waited 2 months or longer to see a specialist, compared to 6% of Americans. Furthermore, 53% of Canadians couldn't get care within 48 hours, although the US rate was 42%. Also, many Canadians have said to have had difficulty accessing medical care on weekends, holidays, and evenings. Another con to universal health care is that not all things may be covered by it. Canada has certain social programs, but they don't consider prescription drugs to be essential. In Australia, Canada, and the UK, dental and vision are not covered, and Canada doesn't cover mental health. Now that I have mentioned a few disadvantages, I want to talk about the advantages. First of all, it can save more lives. According to the U.S. Library of Medicine, over 40,000 people died due to lack of health care insurance. Also, people can deal with illnesses before they get out of hand. An example of how it can save more lives is Canada and Australia. On a list of deaths that could have been prevented with proper access to care, Australia ranked 3 out of 11, and Canada ranked 7 out of 11, while the US was last. According to CNBC, Australia has 3.3 infant deaths per 1,000 live births, while the US has 5.8. The US maternity death rate is higher than Australia, Canada, and the UK combined. Next, healthcare. Universal healthcare can improve public health. Countries with universal healthcare have longer life expectancies. Also, people won't have to delay going to the doctor if they know they won't have to pay a lot of money. For example, early treatment of breast cancer costs $11,000, while late treatment costs $140,000. My last reason supporting Medicare for all, is that the cost of healthcare for each person in the countries with universal healthcare is lower than the US. The US spends about $10,000 per person on healthcare, while France spends less than $5,000, and France's healthcare system is considered to be one of the most expensive in the world. Also, the US spends 17.2% of its GDP on healthcare, while countries with universal healthcare spend less or more than half of the US's GDP. To summarize, I think Medicare for all would be a good idea in the US because it can save more lives, improve public health, and it costs less per person. The US spends a lot of money on defense and military, which is important, but I think it's time to focus our time and priorities on improving the lives of American citizens. I think what's happening right now is really showing how badly America needs to change and reform its healthcare system, and how badly we need Medicare for all.